Alright, today we're going to go over Unit 8, inserting an NG tube, suctioning and care of the NG tube, NG medication, care of gravity pump and feeding, and finally the removal of the NG tube. First thing we want to do when we go into the room is we want to verify our orders. We want to go over a few different reasons why an NG tube might be placed. When a patient is on a ventilator, they'll get an NG tube. Whenever a patient has a bowel obstruction is another reason they'll do an NG tube. Or for patients that maybe need some nutrition, they'll go from an NG tube and transition to a PEG tube. We're going to do our usual K-wipes and then go on to our two identifiers, double checking stand check-its, 6842, making sure that matches the AD band. Then we're going to do a small assessment on our patient. First thing that we want to do is assess the patency of our nares. We can do that with your pin light. Looking for any obstructions, any bleeding, any irritation. We want to ask Stan, do you have a history of basal surgery or deviated septum? We will check Stan for a gag reflex, making sure he has a gag reflex, and the mental status of the patient, if he's alert and oriented, and if he can help with the procedure. And lastly, we will assess for the size of the tube needed for the NG insertion, which you can find on your orders, which is a 12 French. I would take the tubing out of the thing. It wants you to warm it up with your hands. After we do this, I want to put on clean gloves, and I want to start measuring for the NG tube placement. Make sure your patient is in a high phallus position. We'll start the measuring. We're going to take the tip of the tube to the tip of the nose. We're going to go to the earlobe, and then we're going to work our way to the xiphoid process, and that'll be how far we expect to put the NG tube in, meeting at the tip of the nose there. Usually I'll put a mark with a piece of tape, and we will get the patient a cup and a nemesis basin. Then I want to lubricate the tube, and I'm going to insert. We'll insert it following the curvature. As we get to the back of the throat, we'll have the patient lean forward and start taking some sips of water. And as the patient's taking the swallows, really pushing that tube in as we go back. Once the tube is at the tape mark, we want to check our placement. Now make sure that when you're putting in the tube that we're not forcing the insertion. If you meet a lot of resistance, pull back out and retry. You may need to switch nostrils. I want to have my pH strips ready. I have these on the table here. I will get this out. We will aspirate our stomach contents. We'll put this in here in the tube, just pulling back up a little bit, enough to get just a little bit in the tube. We will pour this onto the thing, the pH strip, and looking for a low result, expecting it to be high level of acid content. The next thing we're going to do in this little box is we want to verbalize that the patient needs to go to x-ray while we do. On this sheet, the critical one is aspirating stomach contents. The most important one is our x-ray verification. That's the only way we definitely know where it's at. You'll want to put on your Lopez valve, which will be disconnected. Just put it on blue to blue, and then you can put this side in to make sure that the tube doesn't leak. We will fasten this to the patient's nose. Some hospitals and some kits will have a little strip. You can take a piece of tape. We will put it here. We want to on the nose and just wrap it around. Then I want to take our safety pin. We can put it on a second piece of tape here. And put it on the patient here. Put our safety pin through that. And leave that on. We will anchor to discard. We're going to discard our supplies appropriately, remove our gloves, wash our hands, assist the patient back to a comfortable position. After we get back from x-ray, we can connect our suctioning. You'll have a little connection piece there. Your suctioning connects to this tubing. It does not connect to this. I don't know that this kit has a little device, but it's a little device. It'll suction will connect to this tubing, and you'll make sure it's on low and intermittent. And that'll be for that one. Now we'll move on to tube feedings. We'll again kind of start over, like we're walking in the room all over again, doing our K-wipes, double identifying our patient, confirming our orders. We will have our orders. Says to give Nutrin 1.0 with fiber, 240 mLs. We have a box of 250. The best way to do this is I will just take 10 out and I only have 240 left in here. I'll put on, once I confirm orders that I did, don clean gloves. I've got clean gloves on again. I'm gonna check my feeding and expiration date. Your tube feeding will be expired, but you'll pretend that it isn't. We already calculated our dose. Review any pre-administration assessment information. That'll be, is the patient allergic or sensitive to anything that you're going to be given via the tube feed. Informing the patient at stand you're going to be receiving Nutrin 1.0 fiber, 240 mLs, and we're going to perform our abdominal assessment. We perform our abdominal assessment. We're going to look at the abdomen. We're looking for any bloating, any swelling. Next thing I'm going to do, so I'm going to listen to all four quadrants. We're listening for bowel sounds here. And then the last thing I want to do is feel, making sure that it's not firm or anything. Now, I want to elevate the bed 30 degrees or higher. We're still up from the NGTube insertion, so this will work. We will discontinue our suctioning because we don't want to suction all tube feeding back out. We will verify tube placement. We will pull this out here, get our stomach contents, checking the pH. It is verified. If this is not your first tube feeding, you will check for residual. The way you do this is just pull all this back out and you will measure all of it. If it's not your first tube feeding, there may be an excessive amount in there due to slow GI motility, patient's not emptying, or maybe you're just giving too much food. Therefore, if we have too much, we would have to call the provider and let them know. They would probably reduce the feeding. Anyways, this will be our first feeding next week because we just placed the NGTube, and we will flush the tube with the appropriate amount of water. According to our orders, it should be 30 to 60. We'll give 30 for the flush, and then I want to remove my plunger. I'm going to have this in here, and I'm going to pour until this is empty because there's only 240 left. As I go higher, the tube feeding goes in faster. As I go lower, it goes slower, and then we will assess our patient and make sure that the patient's not in any distress or any pain. After all that's done, we will flush with water again, having the patient sit upright for at least 30 to 60 minutes. Once you clamp tubing between flushes, if you're disconnecting this a lot, off and on and off and on, then you can clamp the tubing in your hand here. You want to explain how to do it with a pump. You'll have a bag here. You would pour your tube feeding in, and you would just follow the orders and place the correct amount on the pump. Now we'll document Stan's intake and how well he tolerated his tube feeding. Our third one is going to be our medication administration. You'll have 2 meds due next week. We'll have prednisone, and we will have metformin, but we're just going to do prednisone. You'll want to do our 3 checks like we did on our MedPass one, making sure that we're calculating the appropriate dose. We'll go back, we're going to make sure our skill overriders, we're going to do our 2 patient checks, first and last name, date of birth. We're still going to make sure we're doing our pre-administration assessments for the allergies, labs, vitals, physical assessment. Swallowing is not appropriate for this one. We're still going to follow those 6 rights in medication administration: right medication, right dose, right patient, right route, right time, and right documentation. We still want to be talking to Stan and letting him know that we are, why we're giving the medication, the name of the medication, and what side effects the medication might have. At this point, I'll put on my clean gloves. If I have tube feeding, I would stop it, but I don't. If I had suctioning, I want to stop it, and I don't want to resume it for an hour after giving the meds. I will perform my abdominal assessment. I'm going to look. I'm going to listen, and then I'm going to palpate. I'm going to feel. I want to verify your tube placement. Once again, pretty much anytime you do anything with this, we'll verify your tube placement. Pull them back a little bit, put that in there. It is fine. Ensures patency of the tube. We want to make sure there are no cracks, no leaking. I also want to make sure that it's at the same point where I inserted it. If I see it hanging out, it's obviously not going to be as patent as it was. I would have my medications out here, and when we do this, we'll have a pill crusher. You want to make sure if it's a liquid medication, not so much. You will give it, you'll flush, give, med, and we'll flush again. For your pills, you would, if you have 2 pills, even on the same medication, you should separate those. It says crush one medication one at a time. If you crush too many at a time, it causes a thick paste to go in and can clog off your tubes. And again, we would crush 1 pill. So if we had 2 Tylenol, we'd crush 1, give it. I would flush with 5. I would crush the second Tylenol tablet, mix with water, give, and then flush with my last 5 ml. I would continue this till all my medications are given. I would assess how the patient is tolerating this too. Make sure that after we're done with the medication that I'm going to keep the head elevated for at least an hour, especially if there's no tube feeding. And then I want to document my intake and how the patient tolerated. Last thing that we're going to do is remove the NGTube. We're going to check for orders of the NGTube. We have orders that says remove them. I'm going to do my K-wipes. Another critical here, I want you to do my abdominal assessment. I want to make sure that there's no changes and the patient is going bad on me. I will look. I'm going to listen and feel. This is a critical one. Make sure you don't miss this one. I will place the patient at 30 to 45 degrees. I'm going to place a towel over my patient's chest or a disposable pad, and I will hand the patient an emesis basin and some tissues. I will put on clean gloves. I'm going to discontinue my suctioning or feeding if I had it on. I will remove my tape and my pen here. I want to make sure that I, one last time, verify the placement of my NGTube. It's in the right place. And I want to flush with 10 mLs of water. I flush. And the last thing I want to do is instruct the patient to take a deep breath. I'm going to kink it up and pull it out. I'm going to dispose of this per policy, take off my gloves, wash my hands. I'm going to offer some oral care. There's a toothbrush here somewhere. We'd offer some oral care and provide any other comfort needs. And Then I would document how patient tolerated the procedure and document any drainage I had in my suction bin. And that will be all.